BBC News.
Thank you very much, Prime Minister. As you've said, there have been more cases today than there ever have been. If now isn't the time for extra restrictions, when will be? And to both of the medics, can I ask you really straightforwardly, do you think it would be better if there were now more restrictions immediately, and should the public cut back on their Christmas plans?
Thanks, Laura, and I'll have a go at that first. And let me explain what we're trying to do. I think this is the right approach. It's a double strategy. It's a left and a right for Omicron. We're going with Plan B, as we said we would, in the event of the numbers starting to rise, and in the event of a new variant appearing, and that's the right thing to do. And everybody, you'll have heard me repeat earlier on what we need people to do: to use ventilation, to wear masks inside, continue to wash your hands, exercise caution, to do daily contact testing and so forth. If you come into contact with somebody who has Omicron, to isolate certainly if you have Omicron, and to get tested when you want to go to a nightclub or another venue. All those restrictions are coming in, and that's the right thing to do to slow the spread of the disease. But what we're also doing is using a tool that we didn't have, Laura, if you think about it, a year ago, when we were also facing a spike, and that is the huge advantage, not just of testing, but also of vaccination and the booster. The booster does provide, all the evidence seems to be, the booster does provide an excellent level of protection. And we think that given the balance of risks and the balance of continuing uncertainties about Omicron, this is the right approach to take, the right mixture of approaches to do these two things at once. And the progress that we're making with the booster is absolutely vital. These numbers are extraordinary for the British population. I mean, we really are boosting huge numbers of people now. We've got a much higher proportion of our population boosted, as I said at the outset, either than the United States or than the rest of Europe. I think over 90% of the 75 to 79-year-olds have been boosted now, and that's terrific, because it's those groups, don't forget, that sadly provide the bulk of those who are likely to die from COVID. So by getting boosted now, we can really build up our wall of protection whilst we slow down the spread of the disease with Plan B. So it's a two-pronged effort.
My answer would be, ministers clearly have to choose between really unpalatable options, but what we do not have at the moment is clear data on some of the really key questions, and the two that I think are the most important are: what is the hospitalisation of severe disease and, in due course, mortality rate with 2 doses, which we got right the way through the population of existing vaccines, and what are we looking at with a booster on top? Remembering we've now got the great majority of people over 65 boosted, and that rate is going up. Those data will come in. There's some very early indications from lab studies, but they're not really strong enough to be able to make strong clinical recommendations. And obviously, ministers will take a lot of account of new information as it comes in. In terms of your second bit of your question, I think that what most people are doing is, and I would think this seems very sensible, is prioritising the social interactions that really matter to them, and to protect those ones, deprioritising ones that matter much less to them. And I think that's going to become increasingly important as we, for example, go into the Christmas period. And people are also taking a lot of precautions, and I think this is exactly right, so that, for example, if they're going to visit a group of people, or if they're visiting vulnerable people, they're taking tests beforehand. I would strongly encourage that, and strongly encourage sensible things like really good ventilation, meeting outdoors if that's appropriate and easy, and all the things we know that we've done systematically through this. So I just think a lot of this is people following sensible rules, but prioritising the things that really matter to them and deprioritising the others.
Nikki.
Thank you. I mean, all I would add is that my patients have had very mixed experiences through previous lockdowns, and some have been incredibly isolated and their mental health has really deteriorated. So everything that we can do as a public, as individuals, to reduce the burden of the disease, to get our boosters and to make those choices that Chris describes is right. I mean, I want to see my immediate family on Christmas Day, so I'm going to be really, really careful until I get to that moment. And not just testing, but watching what I do and prioritising, working on the vaccine programme, working in general practice, so that I can get those special moments with my family. And I know that that's what everyone will choose to do if they can, because that's our best way through, along with getting booked for their booster.
Thanks very much. Robert Peston, ITV.
With the best will in the world, the